Healthcare, Clinic and Research Center. Get well soon.
Today I'm going to talk about hypertension. In common terms it's called as a BP. Blood pressure anything above 130 by 80 millimeters is called as hypertension. Of course there are grading systems, all that. But irrespective of your age, about 12 years, anyone who's got about 3 readings average more than 130 by 80, we brand them as hypertension and try to treat them through lifestyle and through medications. The current scenario in India, about 250 million people are affected by hypertension who are 30 years and old. 30 plus years of age, there is a cross-sectional study done, and one of the highest prevalence rates are in a state like Kerala, where we've got highest literacy rates as we know, and there is a prevalence rate of about 18%, that amounts to about 25 crores of Indians are suffering from hypertension. Mind you, it is the double the numbers of diabetics who are currently as per Indian data. So out of these 25 crores, only 7.9% of the individuals are well controlled with their treatment and their lifestyle modification. So which is very, very scary number, that remaining about 90% of the patients are not well controlled though they are on treatment. Now coming to risk factors for hypertension, of course there is a familial history which you cannot modify, that genetic what we call. And apart from that, most of the risk factors are modifiable risk factors for hypertension, which are smoking is one of the commonest, especially tobacco in any form can cause hypertension. Mind you, it is not only smoking, chewing tobacco in any form or using as a snuff, any of these can cause hypertension. That is, tobacco is the number one cause. And diabetes, about 30 to 35% of the diabetics are hypertensives, and vice versa also are true. There are two conditions which are goes hand in hand, and so you need to control your diabetes well to keep your hypertension. The other risk factors is cholesterols. As you know, cholesterols are about 5 types are there. One good cholesterol called HDL and remaining 4 bad cholesterols. And when the bad cholesterols goes up and the good cholesterol HDL falls down, there is a reversal of the ratio which results in deposition of cholesterols on your blood vessels and eventually causing hypertension, heart attacks, strokes, etc. So these are the commonest modifiable risk factors which a person can have for hypertension. And other important factor is obesity, lack of physical exercise, and that is most important for most of these diseases like hypertension, diabetes and cholesterol. So obesity is very, very important for yourselves to keep your body mass index below 25 and above 27. The BMI is calculated by your height and weight. It's a simple calculation you can get in all your mobile phones apps, and that if you cross 27, you are called overweight person in India. That is very, very important. Though in abroad in the West we call above 30 as obesity, but in India 27 once you cross, you are called as a overweight person. So please modify the risk factors, and every person at above the age of 40 years should check their cholesterols, their sugars, their BP, and consult a doctor once a year, especially if you have a family history of hypertension, you have a family history of diabetes. What is family history? Either your parents, one of the parents, or your brother and sister. Very important to look at these close circle. If somebody is suffering from any of these complications, you need to screen yourself once a year with the doctor without any symptoms. Mind you, 90% of the hypertension is accidentally detected. It is never patients go voluntarily to the doctor. The commonest misbeliefs about BP, somebody is shouting, somebody gets angry, people call them having hypertension, which is a wrong. It is a myth that people who are expressing anger do not have BP. That is a commonest misbelief people have. It is usually 90% of the cases it is without any symptoms, and that is something which you need to get. And as I said, most of the times it's accidentally detected. When a patient comes for some other ailment like cough, fever, we tend to detect their BP at a very high levels of 170, 100 example. And of course, coming to the management part, the management involves the looking at the risk factors. So we definitely estimate the risk factors like their body weight, first commonest things we check, and their cholesterols, their sugars, their thyroid levels. These are all the causes of something called as a secondary hypertension. Their kidneys we check for something called as renal artery stenosis, especially young hypertensives. Mind you, in India, 1 in 5 are young hypertensives. Out of 5 BP patients if you take, one of them is a young. Young is what? Around 30 years. That is what we call as young hypertensives. So very, very important that these complications to be prevented. As I told you initially, the WHO has listed 19 leading causes of death, out of which the topmost cause of death is hypertension uncontrolled. Uncontrolled hypertension across the globe. It is not only in India, even if you take in the West also, the commonest cause of death or complications is uncontrolled hypertension. And coming to after the investigations, the management involves the treatment. Most of the patients, when we initiate a treatment, they think it is lifelong, so they hesitate to treat or initiate the treatment itself, which is again a misbelief. It is not going to be lifelong, especially if you change, you quit your smoking, you bring down your weight, you control your sugars, you control your cholesterols, then your BP definitely comes down, and that medicines can be stopped if you are good at your diet and exercise and reach those targets. It can be stopped, and it's not going to be lifelong. So, but whenever a doctor tells you, prescribes you anti-hypertensive, that is a drug, please take it regularly. That is another misbelief people have. Some people try to take it alternate days, some people at various timings. Again, that is a bad habit of taking the BP pills at a various timings. Please stick on to the timings of BP medicine, irrespective of your food intake. Consult your doctor if you have any doubt, and keep consistently about the treatment part. And whenever a doctor calls you to check, you can definitely go to him and check it on a regular basis, so that your BP more or less is kept under control at 130/80 millimeters of mercury at any given point of time. This is another misbelief. People say that I came on cycling, I came rushing, so my BP went up, all that. It usually, if it's well controlled, it should not alter on these various fluctuations. They're all called physiological activities. We usually check after 5 minutes of rest, the BP is checked, and most of the times it will be high when people are not well controlled. So don't be under the misbelief that it is going to be life-threatening and it is not going to produce any symptoms. Correct, BP is one of the silent killers we call. So unless you go to the doctor on a regular basis and check, you cannot claim that you are fit and perfect just because you're swallowing a pill. It doesn't translate into that. So please go for a regular check. Please change your lifestyle with respect to your risk factors and continue the treatment until a doctor tells you to stop or modify. Do not change the dose. Do not miss the dose. Very, very important. And keep yourself fit so that you don't get into complications because of poor control of hypertension, which is one of the easiest way to treat and preventable diseases in future, so that you take care of your health and do not get into complications. And the commonest complication of uncontrolled hypertension is heart attacks and strokes. Please remember, again, this is a preventable complication once you're diagnosed with, and be regular on your diet and exercise.
It's like a magic. You start feeling better when you're in life care. Life Care, Clinic and Research Center. Get well soon.